Hey everyone, I'm Jason Mazy with Mind, Body, and Soul Fitness. I'm here today with Dr. Mike. Dr. Mike.
How you doing, everybody? I'm Dr. Mike Pavan. I'm a chiropractor here in Santa Clarita, as well as Santa Monica, and we're gonna shoot the breeze with you guys today.
Absolutely. So Mike, tell me, what did you used to do before you got into chiropractics?
I had graduated high school and wasn't sure what I was gonna do, and so my dad wasn't gonna have me sleeping in every day forever. So he was a framer. He retired 10, 15 years ago, but I went and slugged lumber with my dad, framing houses. So I did that for about 8 months.
It was up in Canada.
This is up in Canada where I'm from.
Okay.
Yeah, and I knew as September was coming close that the cold weather was coming close as well. So a friend actually approached me with the idea, and he was already determined that he was going to become a chiropractor. And he asked me, he's like, if we get it, both of us do it, we can help each other out and we'll get through this and become a chiropractor. So obviously, I did some research. I hung out with some chiropractors, and I decided, yeah, perfect with your hand. I wasn't about to hold a scalpel in my hand. I wasn't that steady or anything, but So yeah, I got on the journey of chiropractic with them. We did our prerequisites and such in Lewiston, New York, over the border from where I live, and then I came out here to beautiful California. Totally escaped the winters of Canada.
Yeah.
And
Much
yeah,
better weather out here, huh?
it certainly is. I'm still here 25 years later.
For sure.
And yeah, I graduated, and I had the good fortune of meeting another chiropractor that's actually from my hometown. I went to work with him for 4 years before I started my own practice with my best friend, who I actually grew up with. He's out here as well. We have the practice that I mentioned in Santa Monica together. And I've been going ever since. The practice in Santa Monica, we started that in 2008, and we kind of grew to where we having two chiropractors in the office. Also have therapists there. It became a little bit much. We didn't both need to be there, so we started splitting the time. Which going there 2 or 3 days a week to Santa Monica gave me 2 or 3 days a week here in Santa Clarita. So
For sure.
I'm in Santa Clarita, and I've been here for the past year and a half, and
Nice.
yeah, it's been great so far. I love this community, and now I'm actually starting to be a part of it, and it's wonderful because I get to meet people like you. We get to
Indeed.
do something like this.
Yeah, we
We
definitely.
get to hang out and bore people with our
I don't
conversations.
know
So
what you
yeah.
call it that. Well, your story is interesting because if you got into it and started your business in 2008, you said
2008.
I started mine in 2007. Right.
That's it. And I'm a
So
year older than you. You're
yeah,
younger than me.
yeah.
That's kind of cool.
So I'm not too sure if you knew this, but I also had a construction background. So I got into it in about like 1997, and I did a lot of land development out here in this community.
Okay.
So New Holland and Farm back then in the late 90s, we were developing all kinds of hillsides, and this was a really small town.
Okay.
It's grown to over 300,000 people now, but back then it was a very small town. Valencia barely existed. And I worked my way up in the ranks. And in 2007, most of the jobs that we had were being financed by Lehman Brothers, and that was before the housing crisis hit. And the home builders were starting to stopping to pre-purchase lots from us.
Okay.
So a lot of the old timers that I was working with, they've been through countless recessions. They
Right.
used to say, "Oh, it happens every 10 years or so," and they would say, "Hey, kid, this one right here is going to last for about 10 years, man. I know you got a resume that's good, but there's not going to be any work to apply for, so you need to find something else. This career is gone for a decade." And that was a tough pill to swallow. So I started going to the gym. Was a little stressed out, to say the least. Had
That's a good way to take
had my
that
son
stress.
Jacob.
Okay.
He was first born right there, so it was the wrong time to be losing a job, right?
Right.
And started, banging out some weight so I can feel better. And I was looking around. To be honest with you, I saw all these trainers sitting down on the ground, sitting cross-legged style, not paying attention to their clients, and a light bulb went off. So I went up to the front desk. I said, "How much do you guys charge for personal training? I'm just curious." I said, "Oh, we could set you up with a personal with a salesperson." I said, "No, I was just curious what the hourly rate is." "No, it's $80 to $100 an hour, depending on the package you buy." Just boom. Oh, okay, thank you so much for your time.
That works. That works.
I said, you know what?
Bucks an
I'm gonna
hour,
move into something
sure.
else, right?
Right.
And obviously, I didn't want to work for the big gym. The whole goal was to start my own business, right?
Okay.
So 2007,
So you knew that right off the bat?
right
That
off the
you-
bat, wasn't trying to be an employee and work for $20 an hour.
Absolutely.
And while the gym takes the whole pie, this is why you get the low grade trainers at the big gyms, right?
Right.
Right. So basically, went to school, took my school serious. So got NASM certified. It's National Academy of Sports Medicine.
Okay.
Certified personal trainer, and that was like the least of the things that I wanted to accomplish. So I started getting to different fields of study, like perimenopause, menopause, postmenopause. Wanted to educate myself in regards to women's studies, and then I got into corrective exercise.
Good for you for getting into that kind of stuff, man. Gee.
Thanks, brother.
Vicious.
Yeah. Well, I didn't want to. I wanted to separate myself, right?
Gotcha.
So, and it's an industry. There's a lot of trainers in this industry. So
As there's chiropractors, yeah. I understand
Exactly.
that. That's good.
that's what we do. So, then I got into performance enhancement specialist, which got into the athletes and the nutrition, and every 2 years my license expires. So
Okay.
instead of just doing the basic CEUs to obtain another personal trainer's license,
have the same thing.
I always go for the next license. Broaden my education, get the CEUs at the same time,
Yeah.
and then they just give me another personal trainer license like that,
Fantastic.
So, but yeah, so today, that's pretty much like an introduction on what we're doing. We're going to go over 3 topics, right?
Yeah.
We're going to be talking about debunking fitness and wellness myths. We're going to go over recovery and ways that we can, improve people's quality of life, right?
Right.
So those will be 3 topics that we're going to be going over in regards to educating you guys today.
From a personal trainer point of view and a chiropractic point of view, we may agree on probably majority of things because I think we do. We are friends, and we might, not see it completely eye to eye on some things, but I don't think there'll be many of that. But it might become interesting.
2 Italians in a room. Not always
So so let's get started. Let's dive right into the first myth, which is do you need to work out every day to see results? Like, what does it take to stay healthy, Jason? From what you've seen, from what you've witnessed, from what you've learned with all these CEUs that you've obviously obtained that I did not know about. You live it every day. I come and do the HIIT class with you every Monday through Thursday, and I feel great. I mean, I know like that helps me. I could absolutely go take it a step beyond, a little bit better nutrition and such, but that works for me. But there's some people that just don't have any idea. Right. So if you could kind of sum it up as easily to in layman's terms, and to somebody simple-minded, quite like myself, right, what does it take to stay healthy?
Well, I think that's one of the biggest myths in the fitness industry is that you got to kill yourself in order to get results, right? You got to work out every single day. Got to be in the gym. Some people talk about 2 a days. Where you're going to the gym in the morning, going to the gym at nighttime, right. And we all live busy lives. Yeah. That's not practical. But realistically, you just need to be in the gym probably 3 to 4 times a week. Okay. You gotta hit some weights. Gotta have strength training. Muscle is metabolism, okay, right? At the end of the day, right. That's one of the ways we can fix somebody's metabolism by adding muscle to their body, of course, right? But for sure, you can't outwork a bad diet, like you said a second ago. Right?
I mean,
we can all work on that.
We can all work on that, yeah.
So
we like to eat,
and just active rest, right? So yeah. Like you at the gym 3 to 4 days a week, and then you got to go on some walks, right. Whether it's with
taking the beautiful Santa Clarita scenery, yes, exactly. And it's hilly.
Exactly.
Sometimes the walks are not just a walk in the park, man. There's some hills in my neighborhood, anyways. It's hilly. Whew.
Yep, on the way down, on the way up. Yeah, for sure. But ultimately, it's really not that hard, and a lot of people are afraid to make a commitment to the gym because of all the different things that they've heard of or seen, or maybe potentially got hurt or whatever the case may be. But right. I think a slow, steady start, right. is best for people. I usually recommend people start with 1 to 2 days a week in the gym.
Okay.
And that way they don't overwhelm the soreness. Right, and then kind of get turned off.
Fed up. Get turned off. Exactly. This hurts me.
This feels horrible, you know? So you kind of work into it.
Yeah.
Then work up to 3 to 4 days a week. Then start adding in the walks and, after dinners and stuff like that. And, just trying to make better choices with foods,
Yeah. Yep.
That's one of the myths in my industry. But, like, in regards to chiropractic care, right, you always hear, does cracking joints, cause arthritis?
Right.
Is that true?
No, it's not, because what we're trying to do, arthritis is, well, there's two kinds, and I'm going to touch up on the one. There's psoriatic arthritis, which is you're born with. It's something that's going to be in you no matter what. It's going to develop. It's something that happens. Then there's degenerative arthritis, and that is when the joints start, the spaces between the joints, they start to diminish. You have like a little bit of breakdown in the area. You'll get some like osteophytes, basically the bones trying to connect, and that causes pain, because what's happening is that they're coming immobile. There's less and less overuse syndrome. Whatever the case may be. If somebody is just pounding, construction workers pounding with a sledgehammer constantly, using a gun, using a drill, the joints kind of break down over time. So with chiropractic, we're trying to mobilize the joints. We're trying to keep the body moving. We're trying to keep things from being fixated, stuck and immobile, essentially. And thereby, we also, what causes pain is when the joints when things like arthritis happen, then there's decreased joint space. It puts increased pressure on the nerve. That causes pain. So what we're trying to do is just take pressure off the nerve, do the total opposite of what arthritis causes, the symptoms that it causes. We're trying to eliminate that, and as a matter of fact, we slow the process down. We may not stop it completely, depending on what people do, how they do take care of themselves and such. For sure. But we can slow it down, slow it right down, stop it, depending on how old a patient may be, a person might be. We absolutely do the opposite thing of causing arthritis. For sure.
We could all use that, especially with the neck. What about with the neck? Is it dangerous to crack the neck? Everybody's always afraid about getting the neck cracked. Do you hear that a lot?
Every day. Yeah. Every day. Okay, just please adjust everything. Just let's not do the neck. Okay. I just laugh. I laugh to myself, and people they think like I'm taking offense to it, which I want what's best for the patient, and I in no way, shape, or form do I want them to be afraid of coming to see me. I'm going to help in any way I can. If they're that petrified, you remember when you were a kid and you're going to the dentist, man, I remember when I would cry. I don't want to get my teeth scraped and such. I don't want somebody to have that fear of coming into me. Mm-hmm. Going to your question, there's, when there is already, there's the vertebral artery, which is the blood supply to the brain, okay? And it's very exposed in the upper cervical spine, right at C1, C2. And there are cases where if there is compromise already, so a lot of people that are possibly, there's a lot of degeneration in that area. A lot of, the term is called vertebral artery desiccation, where there's already like micro tears in that artery. So someone who could be susceptible, yes, there's that. There's actually a guy that came into our office last week. One of those guys that has like a million IQ type thing. He just knows everything about everything. And he just made the comment. He just said it out of nowhere. I was about to adjust him. He's like, I love coming here. This is fantastic. He's like, people go to the medical doctors and they don't even know that the statistic is like 1 in 4 million of, of chiropractors actually hurting you or causing some kind of damage, where it's like, it was something like a lot lower for medical doctors, like 1 in 100,000. Don't quote me on that. But something
a lot more dangerous to drive a car then.
Yes. So what the thing is that you have to do as a chiropractor when it comes to things like that. You have to take a good history. You have to listen to the patient. You can't just have it in mind. Okay, I already know I already know I'm gonna fix this person. I'm gonna adjust everything just what I was taught in school. All my good adjusting techniques. Right. Listen to the person. Look at the person. How old is the person? There's a test called declines test where you're gonna have the patient if they're older, if there is any trauma, any major trauma when they come in, depending on the history. Like I said. you're going to have them extend their heads. You're going to have them follow your finger and look for any nystagmus. Like, there are symptoms, or just like the history alone. Man, I fell off my head off a 2-story balcony.
Yeah.
We're not really going to adjust your neck in this case, until x-rays are taken, until an MRI, until we have these things. So
that brings me into the no pain, no gain concept. Right?
Right.
How do you feel about that? In regards to, do you ignore these things? You try to tough them out, and when it comes to chiropractic care,
Well, it depends on.
I get that question a lot.
I was gonna turn that right back around on you, but I'll answer the question and then you're gonna answer the same question
for sure. Yeah.
There's some cases where people have just been living with it for so long. Okay, so muscle spasms are going to develop. You're going to get severe muscle spasms. There's one case. I have one person who just has constant neck pain and is paranoid and does not like the cervical adjustments. He's been living with it for a long, long time.
Right.
And in cases like that, you're going to have tons of muscle guarding, muscle spasms. The bone essentially is used to being like that. Your body has developed. People that can't are kind of say this. For this is as an example, or they're stuck in a certain area. You're gonna, if you can't turn that way, you're gonna use your whole body. To turn, to look.
That's the worst too, when you're stuck like that.
So there's some work to be done. And I mean, I don't want to say no pain, no gain, but may not be pleasant at the initial stages of care, of getting adjusted, of doing the modalities, of loosening up those muscles. There's always ways of doing it, and you got to judge it. Talk to the patient. You got to have a relationship, motivate the patient. How do you want to do this? Are we going to get in there aggressively? Right. Do you want to do this? Right. It might be a little rough at first. We have to align the spine as we adjustment, but it's not necessarily, that's not my motto. It could be somebody else. I don't know. I can't speak on behalf of all the chiropractors all over the, no pain, no gain.
So getting aligned can kind of make you sore.
Absolutely.
Versus being unaligned.
Oh yeah.
In the beginning.
Absolutely.
Until it
absolutely.
kind of sets.
Until we start to align, everything starts to align. The adjustments become easier. Mm-hmm. Not in it takes some time. Every case is unique, but it possibly could be. In other cases, no. It's going to be easy as butter. Some people come in and I'm thinking, oh boy, this is going to be tough, man. I see that their hip is extremely high on one side, whatever. They might be a little bit big or whatever. I had this one guy a couple weeks ago in Santa Monica. He came down he was in New York. He was in a third floor, on the third floor in an elevator that the elevator dropped. Landed, boom, right down to the first floor.
4 stories?
Three. He was on the third floor and right back down. I thought, first of all, and when people are in that amount of pain, when they can't move, you're thinking, man, this is going to be tough. Yeah, I'm going to have to go, I'm going to try. I want to move it. Once we ruled out, he had the x-rays taken. There was no fracture in his spine or anything like that. Make a long story short, he's a bigger boy, a little bit bigger than me, So I'm thinking, it's going to take a lot to move him. I literally put him in position. He was tensing and sweating the whole time. And I went to adjust it, and literally I put him into position, and things just moved. Like it was smooth as silk. And he was actually using a cane that day. He came into the office the following week for his second appointment, and he was without the cane. And he was walking. He still haven't paid, but
let's go.
So it all depends. You can't just. It's not just a general realm. Sometimes it is no pain, no gain. Yes, absolutely, but not. It doesn't have to be, and it's definitely not all the time. So let's bring this to you now. Is it, if you want results in the gym, is it no pain, no gain? Because personally, for me, I love coming to your gym, and we'll probably elaborate on this a little bit later, or possibly in a different podcast. But I see these guys that are totally jacked, ripped, in great shape, great physical health. Mm-hmm. Is it, and I think, I don't know them personally, but I think, those are no pain, no gain kind of guys. Is that what happens?
I think there's 2 answers to that question, right? Because in the beginning of a fitness program, if you're not used to training, and sometimes you could be used to working out, but not training in an entire way that we train, right? And you're neglecting certain muscles, right? So obviously in the first 2 weeks, you're going to be sore.
Oh, I know. I can speak from experience, yes. The first 2 weeks at your gym, absolutely I was. With you smiling at me as I was working out. Yes, go on.
That's our common thing. But the main thing is that you push through that. because a lot of people never get a chance to fall in love with the way good proper blood flow feels in a healthy body, and that can become addicting.
Yeah.
So a lot of the times, people get turned off on that pain phase, right? And they never get away from the stagnant blood flow, and then they quit, and then they I want to go back to the gym, and then they go through that first 1 to 2 week phase again, and then they're hurting again, and they're forever just walking around saying working out sucks, because it just hurts.
Sucks.
But they never got past the 2 week phase to where it started to feel good, and they never stuck with it long enough to start feeling good blood flow, and the lactic acid always being built up in the muscles. Now you're starting to get in shape, and you're not supposed to feel like that when you work out, you know? Obviously, you can always take a body to failure and go find soreness, but not like first 2 week soreness. That's a whole different soreness. And then there's the flip side of preventive injury, right? If you're doing squats and you're not with a trainer, or you're doing deadlifts, and you're not with the trainer, and you don't know what you're doing, right? It's
kind of like me.
You can hurt yourself.
I mean,
right?
Yes, you've corrected me and still to this. Just the other day, you corrected me with my form. I mean,
correction.
I don't mean to, but yes, I totally, and I could feel it. And as soon as you correct me, you notice the difference.
But that's the
immensely.
pain. That's the pain we don't want to push through.
Right. No,
right.
Of course.
So some people will be like, I gotta work out, you know, and they end up hurting their knees, end up hurting their back, and that's the kind of pain. You know, muscle pain is different than joint pain, as you know, right? Joint pain is a whole different issue. That's potential injury, you know. So I mean, at the end of the day, that's no pain, no gain in the beginning, but also no pain, no gain. No, we don't want pain when it comes to form, right? So we got to make sure that we correct people, get people on, and just give them the basic fundamentals of fitness. And I've always felt very, very clear on one thing, is that the gym and training, or fitness classes, or whatever it is that you do, it can never be treated like a bicycle. It's never something. Doesn't matter how many years you put behind you. I see a lot of times people working out 10, 15, 20 years, right? You start getting this bicycle mentality where I just hop on my bike and ride it, because I've been doing this for so long, I don't need to think about it no more. Opposite. You know, you never want to stop thinking about what taught you how to ride a bicycle. You never want to stop thinking about you know, your mind to body muscle that you're working. You don't want synergistic muscles to take over and assist the movement that you're doing, right? You want to isolate if you're doing isolation exercises, and you know, compound movements come with compound movements, right? But you got to always make sure that you're focusing on the rep, because that's when you get hurt, when you stop thinking about the basics that keep you injury free, right? So, you know, to answer your question,
yes,
you know,
I mean,
a little bit of both, right? A little bit of both, right?
So possibly there is a little bit of no pain, and same as chiropractic, possibly in the introductory week to 2 weeks, you know. But that's all. That's all.
Yeah. and with that comes, you know, recovery.
Yes. And feeling great. Getting past that, and then feeling great.
Another thing we wanted to discuss with the people out here today: recovery.
Is that our next topic, or is we? It is. Okay, fantastic.
What do you feel about recovery and how it affects spinal health and joint health and everything, right?
You need to recover, man. Your body needs to heal. I mean, we have to allow our body to let it do its thing. You know, in chiropractic, we have a term, innate intelligence. You know, our body's own ability to heal itself. So, you need that time. You need the sleep. You need, if you know something is swollen, you need to put ice on that. You need to. Yes, absolutely. You need to rest. Sure. And sometimes, you know, I'm not saying, sometimes you can still keep the body moving, keep going, like, you know, with a lighter, say, workout or whatever, but you do have to let the body rest, whether it be sleep, icing, therapies, you know.
Couldn't agree more with you. We provide two different ways of recovery at the gym, you know, in regards to, you know, I know that's how you guys do things, but obviously we send you guys clients, and we firmly believe in what you're saying in regards to that. But two ways we do is with infrared saunas. Great wavelength, increase the blood vessel size, you know, increase the blood flow, which allows recovery to happen at a faster rate, right? And then we also do foam rolling, which a lot of people think, you know, foam rolling is supposed to be oh, you're supposed to rub it and it feels good, and you roll on it,
No, not on the IT
right?
bands, man.
Yeah,
That hurts.
exactly. So SMR, that's one of the things that I was telling you about earlier to get licensed in, and that actually hurts. You find trigger points, whether it be in the IT bands, whether it be in the piriformis, whether it's in the psoas, whether it's in the gastrocnemius, soleus. There's all kinds of different places that we can, and we put pressure into it, hold it for about 30 seconds, and then we do the roll, and that helps a lot, when it comes to recovery. And we heavily urge people to do it, for sure, without a doubt. In regards to recovery, we've talked on rest, saunas, SMR, right? I've heard you talk about modalities and things like that.
Right.
Talk to the listeners about modalities.
Okay, so in the world of chiropractic, chiro meaning to do by hand, basically. That's where, it came from. And I feel, as a chiropractor, I see what the difference does and how it affects and how you can help people with it. As far as modalities go, when I first got out of school, and they taught us about ultrasound sending sound waves into the tissues to break up adhesions and increase blood flow and repair, promote the growth of new healthy tissue. And muscle stimulation, where, it can different effects. It can help, somebody's had a cast on for a while, there's atrophy of the muscle, it helps them.
STEM devices.
Yeah, like muscle stimulation, yes, electrical muscle stimulation devices. You put the pads on, electrodes on whatever the area of the body, help to strengthen the muscle. You could also get an analgesic effect. There's a few things that the muscle stimulation machine does. And that's as far, we actually have a light therapy that we had when we first got into practice in 2008. That was like the whole new thing. So things have been progressing, and I haven't really had my ear to the grindstone until recently. Now, you and I both have a mutual friend, Matt Browning at Mend. And he's fantastic, and what a facility he has, and I've been in there, I've worked with him a little bit here and there, and it's just a wonderful facility.
I send clients of mine all the time over there.
Yep, I have too.
Cryo.
Yep.
What's the other one? A shock in the.
So the PEMF.
There you go. PEMF.
Pulsed electromagnetic field stimulation, which is a form of the muscle stimulation.
The zapping you.
Zap, zit, zit. No, it's wonderful. I had I felt like I had some inflammation in my elbow for a little while, and along with adjusting, I was getting my elbow adjusted, and that, man, the pain did go away. And that's the thing, though. It was something like, I'm like, okay, another form of muscle stimulation, but it's just like it's set up different. But Matt, and he can give the explanation. I'm not the one to give you the explanation about it. It works a little bit differently than just the old school electrical muscle stimulation machines. Right. What that is, I'm not going to explain. I have no idea, but I can vouch that it works. And as a matter of fact, Matt does work with a lot of traumatic brain injury patients, clients, and he uses that, and people that have not been able to use their limbs for months to years, he elicits a response in whether it be the leg, arm, whatever. There's a lot of things that one day we'll have to have him, and we'll discuss it with him and talk to him more. But there's
so many ways recovery, guys, helps
heal the body. Help the body, heal the body.
Just overall, you don't need to have an injury. It goes back into even muscle aches, pains, tendinitises, anything and everything that you could possibly think of. There's ways to do it other than taking pills. Is basically what we're talking about, right? We don't want to get into that, and ultimately that's what we're here for. Is we want to try to prevent that road from happening. It's a horrible road.
Yes, it is.
And I think that pretty much ties us into the third topic, which is what we want to talk about, which is quality of life.
Well, before we do that, I wanted you to follow up on what you were talking about before. How you get in. It sounds like a deep form of
SMR.
Yes, the SMR. Myofascial release.
Yes.
Can you elaborate on that a little bit more? Help me understand it. I know you've done it to me before, and boy, that took a no pain, no gain approach for myself personally.
Your IT bands,
I believe,
right?
you worked on the one side of my because I was totally my leg, hip, and low back area was. But it took a day where I was still feeling the effects, but then the day after that, I felt great. Like it was not even there.
Yeah.
So what are you doing essentially with that? What is happening?
So a lot of that started with that CES do NASM. That's that corrective exercise specialty. Okay. And I definitely took the education beyond and past that. It goes into so many different cultures that have used this deep tissue method.
Okay.
But over the 20 years that I've been doing this, sometimes people that have knee pain, right, have a tight IT band, and it's really simple to find. And just touch it, apply a little pressure.
I do that for you. Yes, I'm familiar with that. Yes, yeah.
We put a couple, 2 or 3, 10 to 20 minute sessions of, and technically textbook calls for almost bringing the client to a tear.
Really?
Yeah, literally. That's actually textbook definition. It's a little rough, because you feel bad.
Right.
But obviously, I got to prep my clients and customers that come in and are looking for this fixture. I'm very upfront with it. Like, hey, this is painful.
Yeah.
But do you want to go down that road of shots, right? It's doctor and pain pills and this and that. Or you want to give this a shot? Because if you want to give this a shot, I can help you. But it's gonna hurt. I'm gonna have to dig in there, and we have to really get in there. And usually, I would even say more than 9 times out of 10 that we end up being able to solve the problem, right?
Outstanding.
Or relieve the problem heavily. And if there's another underlying issue or whatever it may be, maybe there's something else going on as well. Right. We're not 100% healing people, obviously. But in regards to recovery, a lot of stuff. Sciatica, sometimes I'll dig into somebody's piriformis.
Yeah,
it's
that's
like
the spot. Oh, yeah.
Little tendon.
Yes, sir.
Top of the butt.
Yep.
Top of the glute, right?
Yep.
So, I kind of, put them on my table and bring their leg up kind of like a 90-degree angle, and I'm able to dig in there, whether it's with elbow or thumbs.
Yep.
Or lacrosse ball.
Yep.
A couple different tools that we have. Calves. A lot of people have plantar fasciitis.
Ooh, yeah.
I've had some people that are buying hundreds and thousands of dollars worth of soles and inserts and put in their shoes. And, that's one of the toughest ones is when you foam roll those calves, right? You kind of put the ankle in point of dorsiflexion, apply pressure, and some of the ladies, guys obviously can't, say, oh, this feels like pregnancy, right? Because that's something they never experienced.
Right.
But I've definitely had numerous amounts of women that said, this is worse than pregnancy. Right? But they're tough. I must admit, right. Women are tougher than men when it comes to foam rolling.
I found that to be true.
They for sure
yes.
breathe through it.
Oh. Yes.
And it helps, you know. And so then you start seeing people less foot pain, less sciatica pain, less knee pain when they're trying to perform their squats, lunges, and you start to see that go away, and they realize they don't actually have a real injury that requires a surgery.
Right.
That's where the SMR comes in. Ultimately we want to help with people's quality of life.
Yes.
Right. That's what we do.
I need surgery. No, you don't need surgery. No.
Right. No. All bad.
No.
Yeah.
Not yet. No, not yet.
The field is industry. The industry is interesting because there's so much that's been uncovered in the last decade from what used to be, what was the norm in the 80s and the 90s, right?
It's changing. There's different things. There's a lot of wonderful, marvelous, miraculous.
That's a whole nother podcast, though.
Yes,
we can
well,
we could definitely invite some interesting people in here and talk about all kinds of special stuff.
Buddy. What do you think are some overall habits that lead to a good quality of life? General, simple. What do you?
Just quality of life in general.
Yes.
Moving.
Okay.
My grandmother used to have arthritis, and I wish I knew what I knew back when she was in her 70s, which was literally 20, 25, 30 years ago.
Okay.
But she used to always have a funny saying, honey, motion is lotion. Gramps used to always say that.
That's
and
great.
It's always stuck with me.
That's good.
Because as I started training seniors, they all say the same thing.
Okay.
Before I was here with you, I was in pain. And when I take a little time off, the pain starts to come back. Right? So in terms of quality of life, we can't stop moving.
Right.
We live in such a sedentary lifestyle these days.
Absolutely.
Whether you're at a desk or
computer.
or at the home on the couch. And, you know, obviously we live in California. This is a horizontal city. We're not walking around like they do in New York.
No.
It's not a vertical city, right? So everything's in the car. Nothing's via walking.
Right.
You know, you eat something, you gain some weight, right? Because you're just sitting there, right?
Yeah.
So, you know, I think one of the most important parts of quality of life is continuing to move, right? But you gotta lift weights. You gotta have some form of hypertrophy occurring on the skeletal.
And when you
the
say
muscular
that,
frame.
you're not saying, but I think with people that are listening, they're gonna think, well, I'm not gonna go in there. A girl that wants to keep her
Get
protein-
buff.
yeah, and I'm not gonna go and lift like the dudes at the Gold's Gym or whatever, you know, guys
Exactly.
like that. When you say that, I'm sure you mean, you know, we're not talking going bench pressing 200 pounds.
No.
Right?
No.
No. You're just saying
Load. You got to have load, and you got to have impact on the body in a safe manner, right? Women, they have the fight of osteoporosis to deal with, and a lot of women don't understand because it's been, you know, just beaten into their brain. You lift weights, you get buff. But to be quite frank, the average woman, every now and then you find one that has higher testosterone levels than the normal woman, and that's just a hormone, you know, thing that she happened to be born with, where she has more muscle than the average woman. But for the most part, women don't they don't have enough testosterone to even build that much muscle, right? It just doesn't exist. But the same thing, I mean, even if you have a lot of testosterone in your body, you have to also feed. You have to feed the muscle, right? So you're not going to get buff if you don't eat, just like you can't lose weight if you don't go into a calorie deficit, right? So these are all misconceptions, right? That lead to people not having good quality of life because you got women out there not wanting to lift weights because they're afraid to get buff, but they're not going to get buff, and they're actually going to improve their metabolism, and they're going to have a better quality of life, and they're going to feel better. They're going to feel better mentally, physically, right?
Yes.
Everything, right? So I mean, you got that, and then you know, eating well. You don't want to do these crash diets where you're starving yourself, that you're bound to hit a wall, and you're bound to just start tearing up some bad food, you know, because you hit the wall, right? Because you're just starving, right? But you got to find a good quality diet, or not diet. It's really a nutrition plan that's sustainable, you know, for the rest of life. And yeah, do you want to have a pasta dish?
yeah, of course.
Come on, let's have Definitely gonna eat some pasta,
right now, yes.
some guanciale, right? Yeah, of course I want that, right? And of course, definitely do eat that, right? But you got to get right back on track, right? Definitely got to get right back on track. So just eating small portions, being careful with the carbohydrates, walking, staying active, not killing yourself. All these things, for sure, I've seen test of time. Definitely going to give you better quality of life. For sure, brother.
Right.
For sure. Right. What about in regards to you, in regards to quality of life? Like, how does adjustments, you know, pertain to that?
Getting more scientifically based with the chiropractic, you know, yes, majority, you know, if you think chiropractic, you think back, neck pain, you know, but just taking it a step beyond, all the nerves that come out of the spinal cord innervate all the different areas of your body. So the analogy that we were, you know, taught in school, and what I'm sure a lot of chiropractors out there use, is that when there's subluxation, we call it misalignment in the spine, it puts pressure on a nerve. Well, this nerve could be going to, you know, cardiovascular area or lungs or digestion or and such. So the analogy that we use is by adjusting people, we are taking pressure. Basically, picture a garden hose. Every chiropractor, I believe, has heard this, you know, and tells his or her patients this. The water hose is on, but you're stepping on it. That's a subluxation. That's a misalignment in the spine. So the organ that nerve is going to is not functioning correctly because the innervation isn't there. So that's, as chiropractors, that's what we want to do. We want to take pressure off that garden hose. We want that water to flow freely. We want that energy source to be functioning at optimal capacity so you can live your best life. That's, you know, and then going back to the simpler term, we want to keep you mobile. We don't want you in pain. We don't want things being stuck, fixated, and keeping you in constant pain. We want to mobilize that joint. I'm sorry.
So if we were to give the listeners and customers and anybody and followers and anybody something, give them 1 to 2 stretches that they could perform a day that would improve their quality of life. What would you what would you answer that with?
Because I deal with so much low back pain, it's neck and low back pain, but dealing with low back pain, there's what I've witnessed personally is there's a strong correlation where, okay, let's stretch out your hamstring. Somebody, I'm trying to adjust them, can't really get them to move very well. Okay, well, we're not done yet. Let's stretch you out a little bit. We have to do something here. I'll notice that the range of motion with their hamstrings is not good.
I've
It's just not good.
What hamstring stretch would you have
stretches on the, on the floor, simple, whatever it is. If you want to lift your leg up on the table, I'm not going to demonstrate here. I don't know if there's not enough room. No, we're definitely not doing that. But sitting with your legs straight out, knees straight, unbent, and reaching as far as you can to touch your toes and holding that for 30 seconds to a minute. Breathing. Don't forget to breathe. Send blood flow to that area.
I think that's so important to give them a demonstration, because a lot of the times we start to think that some of the stuff is common sense.
I know that's a valid point, right?
I get hit in the head with this every day of how much this is not common sense.
Ladies and gentlemen, for a limited time, go down to Mind, Body, Soul Fitness, and Jason, and if I'm there, we will teach you how to stretch your hamstrings.
But if not, sit down on the ground, reach for your toes.
I'm sure there's social media apps. You can go on
So that's
social
one
media.
stretch. That's one stretch.
Yes, I would go with
What's
that.
the
The
other
other
one?
thing, it's not so much a stretch. It's everybody's is in front of the computer, in front of their phones, sitting sedentary, like you said. I would say to all the majority of people that are in front of the computers, us walking through to get here, everybody was sitting in front of their computer. Everybody that we passed in this massive, awesome, massive, beautiful office building was sitting in front of a computer. If you're working, you got deadlines, whatever the case, set your timer for 1 hour, get up and move. Get up. After an hour, get up, go for a 5-minute walk. Go get some fresh air. Just get up and move, and then get back for at least 5 to 10 minutes. I think that's important, because just sitting all day.
I don't normally sit this long. I'm in the gym. I'm in the gym all day.
I'm ready to wrap this up myself.
I just noticed chest out, shoulders back right now. Like as we spoke, I'm like, wow, I'm actually
As I'm getting
doing it too.
closer to the mic. Yeah. Yes.
For sure.
Right. And how about you?
Yeah.
What would your advice be? I don't
like-
I don't like working out. I don't want to do something, but tell me one thing to do, and I will do it once or twice a day.
It's I would say a plank hold. It sounds really, really basic,
Okay.
really, really simple. You just go in down on the ground, hold yourself on your elbows, right?
Okay.
Just like this, right? Hold yourself up. Work yourself up to a 60 to 90 second hold, right? If you could do that once or twice a day, it will do wonders for quality of life, right?
You do them every
People have
morning.
such a weak core. We have a saying, core is everything over at the gym.
Yes.
And I couldn't agree with it more. But part of the reason why people have that bad posture is because their core is weak. So I think that'd be one of the best ways that you guys could, strengthen your lower back. Your lower back is considered part of your core. At the end of the day, it's not part of your back musculature.
Right.
That stops at the lats, right? So it's all 360 right there. So
Yeah. Fantastic.
for sure.
Fantastic.
But yeah, man, it's been a pleasure. Talking
Always.
with you on these topics.
Always. Yes. Yeah. This was fun.
Yeah, for sure. We'll get into some more topics next week, brother.
Sounds good.
Sounds
Sounds
good.
good.
Awesome.
Thank you. You all take care.
Yep.